Living with sciatica pain can feel like an unwelcome guest, isn't it? That sharp, sometimes burning sensation that shoots down your leg can truly put a damper on your days, making simple activities like walking or even sitting uncomfortable. If you're over 60, you might have noticed this kind of nerve pain becoming more frequent or persistent. It's a common challenge as we navigate later life, and it's perfectly understandable to feel frustrated or discouraged by it. For a long time, many people believed that endless leg stretches were the answer. While stretching can offer momentary relief, it often doesn't address the underlying cause, leaving you right back where you started shortly after. It's like trying to fix a leaky faucet by wiping up the drips instead of tightening the valve. This journey to finding lasting comfort requires a different approach, one that focuses on understanding why the pain is happening in the first place, particularly for those of us with a few more years under our belt. Let's explore together how focusing on the root of the issue, often residing quietly in your lower back, can unlock more meaningful and lasting relief, allowing you to reclaim your comfort and get back to enjoying life's moments without that persistent discomfort. Many people experiencing sciatica believe the problem originates entirely in their leg, because that's where the most intense symptoms usually manifest: that tingling, numbness, weakness, or searing pain running from the hip, down the back of the thigh, sometimes all the way to the foot. It's a perfectly natural assumption. However, the sciatic nerve, the largest nerve in our body, actually begins its journey not in the leg, but high up in the lower back, specifically in the lumbar spine area, L4, L5, and L5S1 vertebrae. Think of this nerve as a major highway transmitting signals between your brain and your legs and feet. As it leaves the spine, it travels downwards, passing through the buttocks, and then branching into smaller nerves that extend into the legs and feet. When something presses on or irritates this nerve at its origin in the lower back, it disrupts those signals, and the pain, numbness, or tingling is felt along the path of the nerve, often most intensely in the leg, because that's the furthest point the signal has to travel under duress. Understanding this crucial connection, that leg pain often starts in the back, is the first step toward finding effective, long-term relief, shifting our focus from treating the symptom to addressing the cause. Now, what causes this pressure on the sciatic nerve, especially as we get older? While herniated or slipped discs are a common culprit in younger adults, often between 30 and 50, they are actually less frequently the primary cause of sciatica in those over 60. It's certainly possible, but other age-related changes in the spine become more prevalent. As the years go by, our spines undergo natural wear and tear, much like other parts of our bodies. These changes might include degenerative disc disease, where the discs between vertebrae lose hydration, and height osteoarthritis, which involves the breakdown of cartilage and the formation of bone spurs, osteophytes, and spinal stenosis, a narrowing of the spinal canal, or the openings foramina, where nerve roots exit. These conditions can gradually reduce the space available for the nerve roots in the lower back. Imagine the nerve root needing a certain amount of space to exit the spine freely. If that space narrows due to thickened ligaments, bone spurs, or collapsing discs, the nerve can become compressed or irritated. This irritation is what triggers the familiar symptoms of sciatica. It's important to remember that these age-related spinal changes are often a normal part of aging and don't always cause pain. However, in many cases, they can progress to a point where they do impinge upon nerves, leading to discomfort. Recognizing that your sciatica might stem from these age-related changes helps us choose strategies that are specifically effective for creating more space and easing pressure in the lumbar spine. So, if the issue is often rooted in the lower back due to age-related changes, what can we do? The key lies in gentle, targeted movements that can help decompress the spine, improve mobility in the lumbar area, and build strength to support the back. These aren't high-impact exercises. They are designed to be accessible and comfortable, even when you're experiencing pain. The goal isn't to force your body into positions it doesn't want to be in, but rather to encourage natural movement patterns that alleviate pressure on the sciatic nerve. We want to create a sense of ease and spaciousness in the lower back. While traditional stretches might pull on the leg or buttocks, which feels good temporarily, the exercises we'll explore focus on gently mobilizing and stabilizing the spinal segments, where the nerve irritation is likely originating. Think of it as providing your spine with the gentle nudge and support it needs to find a more comfortable alignment, allowing the nerve the space it needs to function without being squeezed or irritated. It's empowering to discover that simple, mindful movements can make a significant difference in managing this often debilitating pain. Let's begin with an exercise often recommended for its ability to provide quick relief, especially when sciatica pain flares up the elevated legs position, sometimes called the 90-90 position or supported squat on your back. This position is wonderfully simple and requires minimal effort, yet it can be profoundly effective. To get into it, lie comfortably on your back on the floor or a firm bed. Place a few pillows under your head for neck comfort. Now, bend your knees and rest your lower legs on a chair, couch edge, or a stack of firm pillows or cushions so that your hips and knees are bent at roughly a 90-degree angle. Your knees should be positioned roughly above your hips and your lower legs resting horizontally. Adjust your position until you feel your lower back gently flatten against the surface you're lying on. Allow your feet and legs to feel heavy and relaxed. You might feel a sense of release or softening in your lower back almost immediately. This position helps to subtly decompress the lumbar spine by reducing the gravitational pressure on the discs and joints, which can take pressure off the nerve roots. You can remain in this position for 5, 10, or even 20 minutes, or as long as it feels comfortable and provides relief. Many people find this is their go-to position during painful episodes. As a bonus for those over 60, having your feet elevated above your heart can also aid circulation and help reduce swelling in the lower legs and ankles. Another common concern, especially if you gently pump your ankles up and down occasionally while in this position, adding a warm pack under your lower back while in this pose can provide extra soothing comfort by relaxing the surrounding muscles. Before we move on to the next exercise, a brief but important medical note. While uncommon, certain serious symptoms can occur with severe nerve compression in the spine. If you ever experience new numbness or tingling in your groin or inner thigh area, loss of bowel or bladder control, difficulty urinating, inability to empty your bladder, or bowel accidents, or new significant leg weakness, please seek immediate medical attention at an emergency department. These could be signs of a rare but serious condition called cauda equina syndrome, which requires prompt evaluation. Your safety is paramount, and it's always wise to be aware of these warning signs. Now, let's explore the second exercise, which directly addresses the narrowing of space in the lumbar spine that's often behind sciatica in older adults, particularly those with spinal stenosis. Research and clinical guidelines often highlight the benefit of lumbar flexion, or gentle forward bending movements, for creating more space in the spinal canal and nerve root exits. Imagine the bones of your spine stacked like blocks when you gently bend forward. The front of the blocks get closer, and the back part, where the nerves exit, opens up slightly. This exercise is best done from a seated position. Sit on a stable chair with your feet flat on the floor, slightly wider than your hips for stability. Lean forward slightly from your hips. Let your hands rest naturally on your knees or thighs. Now, slowly and gently, begin to slide your hands down your legs towards your ankles or feet as you allow your upper body, neck, and head to relax and bend forward from your lower back. Go only as far as feels comfortable. You don't need to touch your toes. You should feel a mild, comfortable stretch in your lower back. At the bottom of the movement, just let everything hang relaxed for a moment or two. Then, slowly slide your hands back up your legs, allowing your spine to straighten back to the seated position. Repeat this gentle forward bending motion about 10 times. With each repetition, you might find you can go a tiny bit further as your back muscles relax. The key is to move slowly and focus on relaxing your back and neck completely as you bend forward. As you perform this exercise, pay attention to your leg symptoms. If your leg pain or tingling decreases or seems to move upwards towards your back, this is often a positive sign known as centralization, indicating that the pressure on the nerve is easing. If, however, this exercise increases your leg pain, it might not be the right movement for you at this time, and it's best to stop and perhaps discuss it with a physical therapist. For those with spinal stenosis who find walking difficult due to leg symptoms, performing 10 repetitions of this seated forward bend before or during a walk can sometimes help increase walking tolerance by temporarily creating more space for the nerves. To complement the seated forward bend, there are a couple of other gentle flexion movements you can explore, depending on your comfort and mobility. If you're comfortable lying on your back, the knee-to-chest stretch can be beneficial. Lie on your back with your knees bent and feet flat. Gently bring one knee up towards your chest, holding behind your thigh or on top of your shin, whichever is more comfortable to assist the stretch. Hold for 20-30 seconds, breathing deeply. Repeat with the other leg. If comfortable, you can try bringing both knees to your chest simultaneously, but only if this feels gentle and doesn't strain your back. Aim for 23 repetitions on each side or with both legs. Another wonderful, relaxing flexion pose is the child's pose, often known as the prayer pose in yoga. Start on your hands and knees. Gently widen your knees slightly if comfortable. Bring your hips back towards your heels as you lower your chest towards the floor. You can extend your arms forward or rest them alongside your body. Lower your forehead to the floor or a pillow. Allow your back to round naturally, feeling a gentle stretch along your spine. Hold this position for 20-30 seconds, focusing on deep, relaxing breaths. Repeat 23 times. These variations offer different ways to achieve gentle lumbar flexion, allowing you to find the position that feels most relieving and comfortable for your body. Once we've gently worked on creating more space in the lumbar spine through exercises like the seated forward bend, it's equally important to support the spine by building some stability. A strong core acts like a natural corset for your lower back, helping to maintain good spinal alignment and potentially reducing the load on the joints and discs. However, core strengthening doesn't mean doing vigorous sit-ups, which can actually strain the back. For managing sciatica, especially in older adults, gentle, controlled movements that activate the deep abdominal muscles are key. One foundational exercise is the pelvic tilt. Lie on your back with your knees bent and feet flat on the floor or bed. Relax your back completely. Now, gently try to flatten your lower back towards the floor by subtly tightening your abdominal muscles, almost as if you're pulling your belly button down towards your spine. You're not lifting your hips, just tilting your pelvis slightly. Imagine you're trying to scoop your tailbone slightly upwards. Hold this gentle contraction for a few seconds, then release and return to a relaxed, neutral back position where there might be a small gap between your lower back and the floor. Repeat this gentle tilting motion 10-15 times. This helps you connect with and activate the muscles that support your lower spine. Building on the pelvic tilt, a modified crunch can help further strengthen the upper abdominal muscles, which also contribute to core stability. Starting from the same position on your back, knees bent, feet flat, perform a gentle pelvic tilt. As you exhale, gently lift only your head and shoulders off the floor, focusing on engaging your abdominal muscles to curl upwards just an inch or two. Your neck should stay relaxed, with the movement initiated from your core, not by pulling your head forward. You can place your hands lightly behind your head for support if needed, but avoid pulling on your neck. Inhale as you slowly lower back down. Repeat for 2 sets of 10-15 repetitions. If a full modified crunch feels too much, simply holding the pelvic tilt and focusing on deep breathing can be a great starting point. The aim is gentle activation, not strain. Having explored some helpful exercises, it's just as crucial to understand what actions or habits might be inadvertently making your sciatica worse. Sometimes, even with the best intentions, common advice or daily routines can aggravate the very condition we're trying to alleviate. For those over 60 whose sciatica often stems from age-related spinal changes like stenosis, remembering that gentle lumbar flexion forward bending tends to create space and provide relief is key. Conversely, activities or postures that increase lumbar extension arching the lower back can narrow that space and potentially irritate the nerve. Let's look at 3 common missteps to avoid, keeping this principle in mind. Navigating daily life with sciatica requires a mindful approach, adjusting our habits to support rather than stress our lower backs. Understanding these potential pitfalls is a powerful tool in managing your pain more effectively and preventing flare-ups. Mistake number 1 often stems from a well-meaning, long-held belief about good posture. Many of us were taught to stand up straight by puffing out our chest and arching our lower back. While this might look poised, this arched lower back position, lumbar extension, is often the opposite of what a spine narrowed by stenosis needs. It can further compress the already limited space around the nerve roots. For someone with sciatica from age-related changes, trying to maintain this rigidly upright posture for long periods, whether standing or sitting, can actually increase pressure on the nerve. Instead of striving for a forced, arched-back posture, aim for a more relaxed, comfortably upright position. Allow your lower back to find its natural, less arched curve. When sitting for extended periods, consider a chair that allows you to lean back slightly, like a recliner, or use a cushion that helps you sit with a slight forward tilt at the hips, if that feels more comfortable. The goal is comfort and ease, not military-style rigidity. Experiment with different sitting and standing positions to find what feels least aggravating to your lower back and legs. Listening to your body's feedback is more valuable than adhering to a rigid, potentially counterproductive posture rule. Mistake number 2 involves an activity most of us associate with health and well-being: walking. While walking is generally fantastic for overall health and mobility, for someone whose sciatica is triggered by lumbar extension, like with stenosis, extended periods of walking can sometimes worsen symptoms. This is because walking naturally involves a slight degree of lumbar extension with each step. If you find that after walking for even a short time, your leg pain or tingling increases significantly, it's a sign that this activity might be irritating the nerve. This doesn't mean you should stop moving entirely. Far from it. Regular movement is vital. However, you might need to modify how you walk or choose alternative forms of exercise. If you enjoy walking, try incorporating regular breaks to sit down and perform the seated forward bend exercise we discussed earlier. This can help decompress the spine temporarily. Consider walking for shorter durations more frequently, rather than one long walk. Alternatively, low-impact activities like using a stationary bike, often in a slightly forward-leaning position, which encourages beneficial flexion or even gentle water aerobics, can provide great cardiovascular benefits without putting as much stress on the lumbar spine in extension. Pedal exercisers that you can use while sitting are another excellent option for staying active comfortably. The key is to find ways to keep moving that don't aggravate your specific condition. The third common mistake I often observe is a reluctance to use mobility aids like canes or walkers. There can sometimes be a feeling that using such an aid signals a loss of independence or implies frailty. However, for many older adults with sciatica, especially when it affects balance or makes walking painful, a mobility aid can be incredibly enabling. Using a cane or walker can shift some of your body weight off your lower back and provide support, which often helps to decrease the pressure on the sciatic nerve roots during standing and walking. It doesn't mean you are giving up or becoming less independent, quite the opposite. It means you are intelligently using a tool that allows you to maintain your mobility, participate in activities, and reduce pain. A four-wheel walker rollator with a seat is particularly helpful as it provides stable support for walking and allows you to take a seated break whenever symptoms flare up, giving you a perfect opportunity to do your seated forward bend stretch right there. Even simple things like using a shopping cart for support while grocery shopping can make a big difference in managing pain. Reframe the use of mobility aids not as a sign of limitation, but as a smart strategy for maintaining an active, independent, and less painful lifestyle. There's strength and wisdom in knowing when to use the tools available to help ourselves. What strategies have you found helpful in managing your daily activities with sciatica? Sharing your experiences in the comments below could offer valuable insights to others facing similar challenges. Beyond the exercises and postural adjustments, managing sciatica effectively involves looking at the bigger picture of your health and lifestyle. Simple self-care strategies can provide additional relief and support your body's healing process. Applying gentle heat to your lower back, using a heating pad or warm compress, can help relax tight muscles that might be contributing to discomfort. Some people find cold therapy like an ice pack wrapped in a towel helps during acute flare-ups, especially if there's inflammation, but heat is often preferred for chronic muscle tension. Staying adequately hydrated is important for overall disc health. Discs are mostly water. While weight loss isn't always the answer, maintaining a healthy weight can reduce the load on your spine. Ensuring you get enough quality sleep allows your body time to rest and repair. Exploring relaxation techniques like deep breathing or gentle meditation can also help manage the stress and frustration that chronic pain can bring, which in turn can sometimes amplify the pain sensation. These complementary approaches, when combined with targeted exercises and avoiding aggravating positions, create a holistic strategy for tackling sciatica. It's also crucial to remember that the information shared here is for general knowledge and support. Every individual situation is unique, and sciatica can have various causes. Consulting with your doctor is the essential first step to getting an accurate diagnosis and ruling out any other potential health issues. A medical professional can assess your specific condition, understand your health history, and recommend the most appropriate course of action for you. They might suggest imaging tests like X-rays or MRIs if necessary, or refer you to a specialist, such as a physical therapist. Physical therapy is often incredibly beneficial for sciatica. A therapist can provide a personalized exercise program tailored to your needs, guide you on proper form, and teach you additional techniques like manual therapy or specific stretches that could help. They can also help you develop strategies for moving safely during daily activities to protect your back. Partnering with your healthcare team ensures you receive the most effective and safest care plan for your specific type of sciatica. Have you had a positive experience with a healthcare professional or a specific therapy that helped your sciatica? Sharing your story could inspire others. Embarking on the path to managing sciatica is a journey, and like any journey, it can have its ups and downs. There might be days where you feel great, and others where the pain flares up despite your best efforts. It's important to approach this with patience, self-compassion, and persistence. Don't get discouraged by setbacks. Listen closely to your body's signals. Some days, you might be able to do more, and other days, you might need to rest or modify activities. Celebrate the small victories: a walk taken with less pain, a night of better sleep, the ability to bend down a little more comfortably. Managing chronic pain is not just about eliminating it entirely, but also about increasing your comfort, improving your function, and maintaining your quality of life. Embrace the process. Stay consistent with your gentle exercises and self-care strategies. And remember that you are not alone in this. Many people successfully manage their sciatica symptoms and continue to live full, active lives. Your willingness to learn and try new approaches is a powerful first step. Taking proactive steps, understanding the nature of the pain, and consistently applying gentle, appropriate strategies can truly make a difference in living more comfortably with sciatica. The exercises and tips we've discussed: the elevated legs for immediate relief, the seated forward bend for creating space, gentle core work for stability, avoiding certain postures and activities, considering mobility aids, and incorporating broader self-care are designed to empower you to manage your symptoms effectively. They are tools to help you navigate your day with less discomfort and greater confidence. Give these exercises a try, perhaps starting with just one and seeing how your body responds. Notice the subtle shifts in your comfort level. What small step can you take today towards easing your pain? Whether it's spending a few minutes in the elevated legs position or mindfully practicing the seated forward bend before a short walk, each effort contributes to your well-being. Your journey towards greater comfort and mobility is ongoing, and every step you take is progress. Keep listening to your body, stay gentle with yourself, and remember that relief is possible.